I'm Dr. Riley with Connected Chiropractic, and we're going to be picking up where we left off on the last video, looking at Natalie's shoulder here on the right-hand side. If you look at our previous video, we have already determined that she has some shoulder limitation on this right-hand side, especially while rotating her arm inwards or internal rotation. And so now we're going to go ahead and check out some of her muscles and actually show you a little bit about how we treat the shoulder here in the office. There's a variety of different tools and methods that we use. And the first one is always just starting with our hands to feel through the musculature of the shoulder to really feel where any type of tightness is, any type of trigger points or tender nodules, anything like that, and really just kind of get in there and loosen them up a little bit. That's kind of always where we start. And so feeling through the muscles is always the most important thing, especially when it comes to the shoulder, is to understand where the muscles are, where they go, and kind of what they do. And so when someone has a problem with internal rotation, a lot of times the external rotators of the shoulder are tight, and that can be a very common place. So that's kind of where we're going to start here. So I'm just going to feel my way through the outside of her shoulder here and look for any tightness, any inflammation, and kind of just see if there's anything that could be causing some tightness, which will be getting in the way of her internal rotation. And pretty quickly I could feel tightness kind of down through her lats and her teres major, teres minor, infraspinatus, and kind of her posterior deltoid coming up through her arm. And so these are going to be the biggest areas that kind of get in the way of internal rotation. And so now that we kind of know where we're going a little bit, we're going to show you a couple different things that we do to target this area. So we're going to start with our good friend here, the Hypervolt. This is one of my personal favorites, and also the patient's as well. And this is generally just going to soften up the muscles a little bit, get them firing and get them ready to be worked on. So we're just going to start nice and gentle and just kind of give her arm a nice little massage through some of those tender points that we hit before. So now that we kind of went in with the small little head, now we're going to jump it back and go to a flatter head to kind of get a little bit broader of an effect here. Alrighty, now that we have woken up her shoulder a little bit and kind of got some of those muscles firing, now we're going to go ahead and target these with a little bit more aggressive of a treatment. If anyone has ever received a massage using a tool or any type of soft tissue work, it goes by many different names. So what we're going to do is we're going to add a little bit of lubrication called an emollient, and we're going to use this tool to kind of scrape out some of these muscle fibers and really bring some good healing blood to the area and help heal her shoulder to help get the fibers moving the way they're designed to.
Alright.
Now you can see by the look of her skin that it is a little bit inflamed. That's a good thing. It just is a sign of good blood flow to the area. And so this is kind of all of the soft tissue that we would do with her today. This is always a great place to start. There's a couple other things we do with cupping therapy and some other type of soft tissue techniques that we use, but for today this is kind of what we're going to focus on. What we're going to do now is we're going to switch paces and we're going to look at some type of adjustments that we would do for the shoulder to help the joints move properly. Now we're going to look at a couple of the shoulder adjustments that we do here in the office to help make sure that the shoulders are moving properly. So First thing we're gonna do is we're just going to feel the shoulder move kind of around in a circle. And just feel for any pops or clicks or anything that's kind of happening to let us know that it may be a little bit locked up. And one of the cool things about the shoulder is it's the most mobile joint in your body, and so it should be moving nice and free, pain-free without any type of big limitations in it. And sometimes there are, and a lot of times it's either muscular, but sometimes it has some joints. So what we're gonna do now is we're just gonna have her bend her arm. Now I'm gonna reach around you like this, and we're just gonna pull up. Perfect, just like that. Just that little stretch through the joint is enough to get a release through the joint and help it move properly. Cool. Now we're gonna go ahead and lay down. I'm gonna have you go on your back. So now we're gonna try a couple other adjustments for the shoulder here. These are a little bit more delicate, so we're gonna kind of use the table to help assist us with a drop piece, which helps make minor movement throughout the joint and really is an easy way to kind of help influence the joint in a positive direction. So we're just gonna start by moving her shoulders through a range of motion here. So I'm gonna have her nice and opened up, and I'm just gonna hold the shoulder, and we're just gonna drop through this a couple times. Perfect. And now the shoulder is connected through your collarbone right to the middle. So now we're gonna come across and we're gonna kind of hold on to that and feel this guy move. And one more time. Perfect. Now we're gonna come up top and we're gonna feel into her acromioclavicular joint here. And this actually feels good. Just a little twist there. Perfect. Now we're just gonna finish by coming across just like that. And we're just gonna go into the shoulder and just move nice and gentle like that. So this is kind of a basic introduction into what we do with shoulders here in the office. We do a number of other things that we didn't quite cover today, and we can do, another video on some of those another time. A lot of them being soft tissue techniques that we use that are different than the ones we use. And so once we get her shoulder moving a little bit better with some of this therapy work, now we can go into some exercises designed specifically for her limitation of that internal rotation, to where she can start actually applying some movement into that so that she can then correct it and fix it for good. And so that's kind of what we're all about, is getting people to a point where they can function properly at 100% without having any type of limitation. So with that being said, I'm Dr. Riley with Connected Chiropractic, and this was your intro into shoulders.